Assalamu alaikum students, welcome to today's class. In last class we have covered, we have started sternum. In last class we have covered anatomical position, parts and attachments. So today we will be knowing relations, joints, ossification and clinical importance of this bone. So this is the sternum. At first we will be starting with relations. Okay. So this is the posterior surface of the sternum. In the anterior surface of the sternum there is no relation. In the posterior surface of the sternum, so in the manubrium, in the posterior surface of manubrium, we will divide the manubrium by imaginary two parts. In the lower part of the body there is a large vessel called arch of aorta. This is a large artery. Okay. So in the upper part of the body there are three branches of arch of aorta. Arch of aorta give three branches. So in the relation of the manubrium posterior surface, in the lower part there is arch of aorta, and in the upper part there are three branches of arch of aorta. These three branches are known as brachiocephalic trunk, left common carotid artery and left subclavian artery. And then there is a vein like this in the posterior surface of the manubrium. So in that relation of manubrium you will say in the lower part there is arch of aorta. This vessel is called arch of aorta, and in the upper part there are three branches of arch of aorta. These are brachiocephalic trunk, left common carotid artery, left subclavian artery and a vein called subclavian vein. And then the body, then comes to the body. In the body, so can anyone tell me heart is in right side or left side? Okay, heart is in left side. So in the right side there is only pleura and lungs, and in the left side there is, in the right side there is only lungs and pleura. And in the left side there is, in the upper part there is lungs and pleura, in the lower part there is heart and pericardium. So we know the covering of lungs is called pleura and the covering of heart is called pericardium. So the relations of lower body posterior surface is, in the right side there is lungs and pleura, in the left side in the upper part there is lungs and pleura, and in the lower part there is heart and pericardium. And these are the relations of this bone. Now we will be knowing the joints of this bone. So we will see the joints from this skeleton. So as you can see, this sternum, first it makes joint with clavicle. Okay. So this joint is called sternoclavicular joint. Okay. With the clavicle and sternum, this is called sternoclavicular joint. This is a saddle type of synovial joint. Okay. This is a synovial joint and type of this joint is saddle type of synovial joint. Then in the manubrium it makes attachment with first costal cartilage. Okay. So this is called first chondrosternal joint. We called rib costo and cartilage chondro, as it joints with, as it makes joints with cartilage. So this is chondrosternal joint. So this is first chondrosternal joint. This is a primary cartilaginous joint. Okay. Then in the joint between manubrium and sternum, in this region it makes joint with the second costal cartilage. Okay. And there are few more costal cartilage up to 2 to 7. These are attached to the lateral side of the body. These are chondrosternal joint. These are plain type of synovial joint. Okay. Then there is a joint between the manubrium and sternum in this region which makes an angle. So this, in the sternal angle, this joint is called manubriosternal joint. This is a secondary cartilaginous joint. There is a disc of fibrous cartilage between the manubrium and sternum, and there is also hyaline cartilage attached to the surface of this bone. So this is a secondary type of cartilaginous joint, and there is a joint with body of the sternum and jiffy sternum. So this is a primary cartilaginous joint. These are the joints this bone makes with, these are the joint this bone makes. Okay. So now we will be heading towards ossification. Ossification is the process of formation of bones. So, this bone or this sternum ossifies from 10 centers. Okay. So, 1 center from manubrium, 1 center for xiphoid process and 4 centers for each side of the body. Okay. So, 1 center for manubrium, 1 center for xiphoid process and 4 centers for each side of the body. So, these 10 centers fuse and makes this bone called sternum. Okay. So, this is all for today's class. In next class, we will be covering the clinical importance of this bone. Thank you.